Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
Hello, and thanks for listening. My name is Dr. Jessica Sum, and I'm a PGY1 pharmacy resident at Blount Memorial Hospital in Maryville, Tennessee. And today I'm speaking with Dr. Michael Mohundro about successful interviewing skills for a pharmacist position in the hospital/health system pharmacy setting. This podcast is one of a series this year that is focused on developing interviewing skills for positions in various pharmacy settings. The series is sponsored by the Phi Delta Chi Professional Pharmacy Fraternity as a part of their professional development initiative and hosted by the Pharmacy Leaders Podcast. I'd like to thank both organizations for their support. Dr. Mohundro is Director of Pharmacy for Our Lady of the Lake Regional Medical Center, an 800-bed hospital located in Baton Rouge, Louisiana. Thanks for speaking with us today.
Thank you, Dr. Sum. I appreciate that for you having me.
So I've separated our questions for today into three main topics. So one is hospital health system practice trends, getting the interview/qualifications, and then lastly, working in the hospital/health system setting. So we'll start off with practice trends. So what are some new roles that you see pharmacists having in upcoming years?
So really have seen it kind of evolving and at a changing rapid pace. But what we're really seeing is pharmacists really being driven to more direct patient care, really having more of an emphasis on transitions of care. There's a big focus on keeping patients out of the hospital now, and certainly when we get them in the hospital, we want to get them out as quickly as we possibly can. And then certainly once they get to the outpatient setting, we want to prevent them coming back in, so preventing those readmissions and ambulatory care kind of taking on a bigger role within a health system. So those are the types of things that we're really seeing that focus on transitions of care.
Okay, so transitions of care and ambulatory care, really a lot of direct patient care.
Mm-hmm.
All right. At your particular institution, how much autonomy do the pharmacy technicians have?
So each state is a little bit different in this regard, but certainly in Louisiana, we're really seeing things change. More things are being given to the technicians, more expanded roles. Certainly what we're seeing at my institution, we're getting technicians more involved in documentation of medication histories. They're taking a role in controlled substance management and monitoring. We're seeing opportunities in information technology and automation. Billing and finance is also playing a pretty big role. Certainly purchasing, patient assistance programs, and probably one of the bigger things we're seeing is expanded roles in sterile compounding, really starting to see the technicians taking a pretty big part of ownership in the IV room, with the pharmacists taking more of an oversight role.
Nice. Yeah, it sounds like there's a lot of opportunity there moving forward. What are some benefits that you've seen in centralized versus decentralized pharmacy models?
So this is a great question, and it's certainly very important. One thing I'd say is, regardless of the system, it is important that whichever model is being used, that it meet the needs of the patients. But certainly both are capable of doing that if managed appropriately. I'm a little bit partial to the decentralized model for both clinical services and distributive. Bottom line, when you can get the medication expertise and the medications at the point of care at the right time, then you can really make the most impact.
Gotcha. So mostly tailoring it to the practice setting, making sure it works for that situation. And then What would you look for when visiting or interviewing at different hospitals in terms of this centralized versus decentralized?
So when you're touring or interviewing a pharmacy, you can get into so many details, and I really do encourage everyone to do their research when going into a site to interview or tour. There's so many questions and so many things you can look for regarding clinical services, really opportunities. What opportunities do they offer for development and advancement? You want to make sure you check out their automation. What did they put in place to improve efficiency? Which electronic health record are they using? That's an important thing to kind of know what you're walking into and how that fits with your background. If you've had any experience with electronic health records, you want to find out about their management structure. So how are you going to be supervised? What kind of feedback are you going to get? As far as what you can find out about the hospital, there's so much publicly reported information these days that's easily found online that you can find out a lot about the hospital just by reviewing that. And then that will give you a lot of questions that you can ask once you get on site. You can ask about the relationship with nursing and what the departmental goals are. And then I would certainly hope, and I think this is really important, that you get the opportunity to speak directly with the staff. That's a place where you can really find out about the culture of a hospital and just how you're going to work with the team. So I think those are all very important and certainly not an exhaustive list, but some good places to start.
Yeah, absolutely. Okay. And the next question is, in the coming years, what do you think are some potential obstacles coming up within the field of hospital system pharmacy?
So as far as hospital health system pharmacy, there's a lot of challenges that are developing today and don't seem to be going anywhere anytime soon. Certainly, you want to make yourself aware of the drug shortages and the rising drug costs. Those have certainly had an impact on how we do business. It certainly has raised the attention of administration. Hospital administration is paying particular attention to pharmacy and what pharmacy has to offer in helping control and manage drug shortages and rising drug costs. We're also seeing roles, as I mentioned before, becoming more specialized and automation taking on an increasing role in care. So, that's something to be very aware of. Also being aware that competition for hospital positions, I think we're seeing hospital getting a lot more attention from pharmacists too. So there's a lot of competition now for these hospital positions. And so in the past, where you could kind of walk into a hospital and, no matter what your background, you were going to get probably an opportunity to get a job there. It's gotten a lot more competitive now. So those are kind of the things I think facing the applicant of the future.
All right. Moving on to getting the interview and qualifications. So does your institution distinguish between a, quote, clinical pharmacy position and a staff pharmacist position?
So yes, we do distinguish between those two. In fact, right now with our new clinical director, we're working through a career ladder that actually distinguishes levels down a little bit further than that. So of course, you're going to have your entry level staff pharmacist position. That position is going to focus primarily on order entry and distributive aspects of hospital pharmacy. But we also have this kind of middle ground now where it's more of a hybrid position where while you have some order entry responsibilities, you're doing more clinical work, potentially rounding, interacting with staff on the floors. And then you also have your purely clinical positions, which are really more specialty positions. Whether that's emergency medicine, whether that's critical care, infectious disease. That's kind of how we have divvied it up and kind of tackled it from how the jobs are, you get different job descriptions and different roles within the organization.
Gotcha. Okay. So since your institution does distinguish between the two positions, what are some of the different aspects that you look for when you're evaluating filling a clinical pharmacist position versus a staff pharmacist applicant?
Okay, so from a staff pharmacist position, we're really looking for that dependability, customer service skills, because you're going to be interacting with nursing and you're going to be interacting with physicians and getting clarifications. We really need a good basic knowledge, ability to work with the team, and certainly efficiency plays a role there as well, since at least in my institution, we focus heavily on order entry. And then that middle ground that I talked about, the hybrid pharmacist, we're really looking for that kind of like the staff pharmacist, or really someone that's coming out of residency that has a willingness to learn new skills, that's really looking for that growth and development, that's looking for that direct patient engagement, and somebody that's willing to go after board certification to really kind of specialize in a certain area and really show off their skills and what they can bring to the organization. And then from a clinical pharmacist standpoint, that's really our subject matter experts, as I mentioned before. We really want to see those folks have a significant clinical experience in a specialty. We want them to preferably have completed a PGY2 residency or have gone after a board certification in a specialty. We want them to have independence, self-motivation, and really the ability to start new services, because it is an ever-changing environment these days.
I see. Some good information to know. This question is kind of going a little bit back to practice trends, but it also has to do with the clinical versus staff positions. So you talked about the hybrid position. Do you see hospitals moving more towards that, depending on, of course, their individual situation?
Yeah, I think we are going to see more of that hybrid type role, because you want to be able to get closer to the patient, to be offering that direct patient care. And if you're kind of managing things centrally from the main pharmacy, you don't have that opportunity to interact with the nursing staff. You don't have the opportunity to interact with the physicians from face-to-face manner, and certainly not to be able to engage with the patients if you're operating from downstairs. So that hybrid role really gives an opportunity to kind of meet all those opportunities while still getting order entry and those things that we need to happen to just keep everything moving within a hospital.
Right. Okay. The next question is kind of referring to what you talked about earlier, where it's really a lot more competitive now for hospital positions. So about how many applicants would you say are you getting for an open position?
So it really depends on the position. So up until recently, very recently, we had really struggled to obtain hospital candidates for even the entry-level positions. You're really looking for those people that had a hospital background or a PGY1 trained applicant. But up until recently, we had a pretty, as new graduates or it's retail candidates. So while we don't always get that PGY1 trained applicant, it's starting to shift a little bit, and we're starting to see where we get to be a little bit more selective in the candidates that are coming through the door. So as far as the clinical pharmacist positions, we still struggle at times to get the exact applicant that we're looking for with that preferred background of PGY2 training. But I figured that's going to come around to as we get more and more specialty PGY2 residencies started. Certainly within the state of Louisiana, those are very limited. So we are seeing a shift, but not a complete shift where we won't see retail candidates still coming through the doors.
Gotcha. Okay. And when you're screening all these many candidate applications, what kind of achievements do you look for?
So when we're screening the applicants just at the beginning, we're really looking at their background and just their fit for the job. We look for job stability, how long have they been at previous jobs. Where we really get the most benefit is after we've kind of done that initial screening and looked and said, hey, this looks like somebody we want to get on site and have a conversation with. That's really where we learn the most information about a candidate. And when we're able to have those on-site interviews, we're really able to judge the candidate's fit for the team. For us, it's really about alignment for our mission with our mission. We get to assess their problem-solving skills and really their drive and motivation, and really what got them interested in our hospital in the first place. So, from the initial screening standpoint, we really, look for some very basic things to really set candidates apart. But it's really what differentiates them is when we get them on site.
Okay. And how difficult would you say it is right now for a graduating P4 to get a job in a hospital without residency experience, like maybe just a staffing position?
So right now, especially in my market, it's not very hard at all. That's pretty common that we'll hire a graduating P4 student. We really feel like they come out of school with the knowledge that we can work with, and really it is not hard to really bring them up to speed to be functioning at a high level in the organization early on of joining the organization. But we are seeing that change a little bit. So while it hasn't become, a major problem yet, I think we're starting to see it shift to where if you're going to see PGY1 candidates applying at the same time that somebody's coming out of pharmacy school. And so we are getting to be a little bit more selective, but it hasn't gotten to that point where it's restrictive to where a P4 candidate wouldn't have the opportunity to come directly into a hospital setting without having done a residency.
Okay. And then kind of going off of that, do you think it might be more difficult if you're coming from the retail setting, transitioning to getting a hospital job?
So I think it is becoming more difficult if you're coming strictly from retail. And I think that what used to be a pretty simple thing, if you're coming from retail, coming into hospital, has gotten a lot more challenging. And so for those candidates, it's really about trying to get your foot in the door. Really, whether that's through compounding, trying to get on with a PRN role. I think that's for a retail candidate, they just have to find a way to get there and prove themselves.
Okay. And what general advice do you have for any pharmacist seeking a job in a hospital and health system setting?
So, really, my advice to anybody trying to get into, once they get there or seeking a job in the health system is really show people what you're able to do. Tell them about your past history. Show them what you're capable of through your CV. Ask a lot of questions. Get to know as much as you can about the organization. Come there prepared, and look for impact. Look for opportunities where you can say, "Hey, I can make an impact here," and show the drive, show the initiative, so that the interviewers of the health system can really see what you can do.
All right. Sounds like some good advice. Okay. Moving on to the last category of questions of working in the health system. So how difficult would you say it is for someone working in the community setting to transition to the hospital setting?
So it's often very challenging to transition from the community setting or retail to the hospital. Full onboarding, at least in my experience, what we've seen can take anywhere from 6 months to a year to fully get to that baseline competence that we need in the hospital setting. That said, some of our best pharmacists have come from the retail setting, and really, when we get them on site, we can really see their drive, their enjoyment of being there, their willingness to work with the team, and they really drive their own success. And that's something I think consistently we've seen, that it's not that it's not doable. You just have to go out there and prove yourself.
Gotcha. Any advice for helping with that transition?
So my advice would be engaged, take initiative, work with pharmacy leadership to help develop an educational plan. So a lot of times retail folks are playing a lot of catch up. So they've missed a lot as clinical has kind of changed over the years. And it's really just trying to figure out how to fill that gap and catch up as quickly as possible to where you can move up in the organization and really get into an expanding role within the organization.
And then what is the biggest challenge that new graduates and residents face when moving into a staffing or a clinical position, just transitioning, I guess, into the real world of
Yeah,
pharmacy?
I think that's what it is. I think it's resetting those expectations, especially if transitioning from that academic environment to more of the real life community hospital setting. That can be an adjustment, getting used to things at a little bit faster pace.
And any suggestions for helping with that transition?
I think that, be patient. I think that a lot of people want to be back up to that, fully functioning, rounding with as part of the team. So it's, taking time to learn your new environment, ask a lot of questions, and look at those unmet needs in the organization. Look for those opportunities where you can make an impact. And then really document, document, document. It's so important these days that pharmacists really show the outcomes and demonstrate the outcomes and all the good work that we can do to really show the value that we can do that. But we can't do that without documenting the good work that we do. So that's one of the things I think is advice that I would have. And that's something that you can bring to your leader, show the portfolio of work that you've done. And really, that's really going to help you move up in the organization and get new opportunities.
All right. Well, thank you so much. I think you've really got a lot of good information here for people who may be looking to move into the hospital health system arena. So that's all we have for today. Dr. Mohundro, thank you so much for taking the time to speak with me. I'd also like to thank the Phi Delta Chi Professional Pharmacy Fraternity for sponsoring this podcast, the Pharmacy Leaders Podcast for hosting it, and the audience for listening. Please check back here for additional podcasts in this sponsored series, focusing on interviewing for positions in different areas of pharmacy practice, including residencies, health system, clinical and staff positions, academia, and industry. Have a great day.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.